If you can't rotate your neck, even tip it, with or without pain, there is something you can do about it. So what we want to do first is figure out what do we have going on so that we can do something about it. So what I have here is a neck model. And on the back of the neck model are your joints. Each bone is connected to the subsequent bone by a joint in the neck. And each of these joints in the neck through here are surrounded by ligaments that form what we call a joint capsule to stabilize that joint. And the challenge with that is that these ligaments can get sprained. And when they get sprained, they can be painful and or they can limit your ability to rotate. A lot of people feel that it's a muscular issue. It is not a muscular issue. It is a joint capsule sprain. So now that we know what it is, the ligaments that cross these joints are sprained, then we can talk about, well, why is it there? It can be because a bad sleep, an awkward movement. Other times it can be because the C1 vertebra up top can be dysfunctional and misaligned. And what happens is then it impairs the nerves that are going to the muscles around the neck, then overloading those joint capsules. And this is very common what I see in my office. So what are we going to do about this? When I have a patient coming in with joint capsule sprain, I will work it for them. And almost every time I will teach them how to roll this because they're going to want to do some work at home. So what I teach them is that these joint capsules can be accessed with a tool. I like a softball. It's 4 inches in diameter and it's a 12-inch circumference softball. I find it's very versatile and very effective. And what we want to do is locate this little line right here on the back 45 degrees of the neck. You can actually press in to find a bony end range. That is the area we need to go. So what we are going to do is we are going to put the ball in that area, starting underneath the skull and working down. How does that look? It's going to look like this. I am going to lay down, I'm going to take the ball and put it behind my neck on that back 45. So in order to contact those joint capsules, I have to turn my head and look at my elbow. Then by pushing through my feet, I create a rocking motion. Nice steady pace as if you were sanding a surface. And just like this with 20 rolls rocking back and forth. Then I will shift headward a little bit. The ball moves down. And then I create another rocking motion for 20 movements. That is the second spot. I'm going to move up a little bit because we are going vertically down the neck, hitting each of those joints with the intention of hitting those joint capsules because we are massaging them. Most people will find 3 spots. I'm at my 4th spot. Keep the movements very small. You can repeat that as many times in a session as you like, and it can be done numerous times a day. The more times a day we do it, if the body has tolerance, then it can improve quite significantly. It can take a couple days, but over time, it should improve. It is not improve. If it is not improving, then we have to consider underlying mechanisms like addressing the C1, and we will discuss that in future videos.